Hello, my name is John Pritchard. I'm Associate Director of Housing and Community Inclusion for Southern Health. So my role is fairly unique within the Trust, and it's all about how we can discharge people out of hospitals much quicker than traditionally they're able to do currently. It's a fairly unique position. We're the only trust in the country to have a director level resource that's dedicated to housing and finding those housing solutions. So the objective of the work is all around getting people out of hospital sooner than they might be able to do otherwise. But more than that, though, it's about how we support them in the community, and not necessarily medically, but around what other support we need to put around them. So things like helping them become embedded in their communities, helping them become contributing members of their local economies. How do we help get them into employment and volunteering and training? Working with partners to make sure they've got the right support and helping them to lead their best lives. One of the new solutions that we have implemented over the past year or so has enabled us to discharge people about 3 months sooner than we would have done otherwise, which is incredible for those individuals, but also really, really important for us as a trust and about managing our bed flow and our capacity. We're working with housing providers, to create new solutions, and we need to do that because they either don't exist or traditional solutions just don't work for the complex cohorts that we work with. So when surveyed earlier this year, the individuals that are accommodated through one of the new step-out models that we've got talk themselves about how they've come on leaps and bounds, since their discharge, since they've lived in their flats. How their relationships with family and friends have massively improved. And how having their own space and their own sort of time to reflect on things has been really important and really beneficial for them. They say they feel relaxed and they feel comfortable and they feel in control. They've got time and they've got space in which to think and work through their ongoing mental health recovery. And they can talk about how they can think clearly and how they can now make decisions, and just having their own home and their own space has been fundamental to that. The positivity that shone through in that survey from those individuals was truly humbling and really quite inspiring. The stability of having their own home has been really important, and it's shown that none of the individuals that were accommodated through that step-out model at that time had an inpatient stay again since, and none of them had accessed an emergency department for their mental health support since they'd been accommodated. The future plans really depend on the needs of the individuals and the different cohorts and indeed across the different locations. But some of the work underway is quite diverse. So we've got more of the same. We've got more of the step-out type model and exploring that in different areas, and that provides a long-term sustainable discharge solution for those individuals. Flexible support wrapped around the individual to keep them well in the community. It's a really, really cost-effective partnership approach with housing providers, support providers, local authorities and housing teams. And importantly, that accelerates the discharge process and prevents readmission. We're also in the process of creating some much closer integration with our local authority housing partners. So in a couple of areas we're just about to second clinical colleagues into their housing teams. It will enable community mental health teams to create a much more structured workload, because they won't be dealing with the crisis presentations that we get from local authority housing teams traditionally. And importantly, admission avoidance. So how can we prevent these individuals coming into the system and becoming longer term patients? if we can work much earlier in the process, perhaps even before people have become open to services, it will certainly enable us to slow down that journey that we see people going through today. Also looking at community solutions, so partnerships with people like Sport in Mind, individual placement and support services, so supported employment. We've got some great links building with citizens' advice across the area to really make those services and that advice and that guidance much more accessible to our patients. So lots going on, very diverse, and right across the patch.